3, 2.
So another thing that you should keep in mind, point number 3, video number 3, is to bring notable results immediately. Our initial evaluation is our chance to show the patient that we actually know what we're talking about. The worst thing that can happen is for a patient to walk in the front door and then leave feeling the same exact way. So you really need to bring a notable result immediately, and this doesn't mean fix them in one visit. It just needs to be something that's tangible, something that can be measured, whether it be range or strength or a decrease in pain, because a lot of the times that's what we're dealing with. We're going to deal with decreasing the patient's pain. So in that very first visit, a very easy way for you to bring a notable result is, one, address their pain. Although there's a time and a place for a heat pack, here at Live Athletics, we're not trying to be like the other clinics where they're more modality driven and hands off, where it's like, hey, you're going to see the therapist for 5 minutes and then we're going to pass you along. You really want to get in there and talk to them and make them buy into you, but also themselves. Some easy ways to do that are provide a plan of care. Let them know that you are following a systematical way of making them feel better, and that it's also going to be maintainable once they're done seeing us, because at the end of the day, really, that's what we're trying to do. We're trying to help you get better and then send you back into the wild. Another thing that you can do is identify achievable goals. You're not going to be the next Steph Curry. Maybe you are, but chances are you aren't. So don't go in there and say, hey, we're going to help you increase your vertical by 4 feet. You can't do that. But you can say, we're going to help you either force absorb or force produce and alleviate some of your pain. That's something that is an achievable goal. Number 3, educate your patient on any false beliefs. Let them know that there are going to be things that they either see or read on the internet or have someone tell them that just simply aren't true. Having a two-way communication with your physical therapist, and on the other side of that, from the physical therapist to the patient, is going to be a very easy way to basically block out all of that nonsense, which will hinder recovery to a certain extent. And lastly, implement effective corrective exercises and manual techniques. Obviously, the manual techniques, that's going to come from us while the patient's on the table, but the corrective exercises, there's a ton that can be done with that. If somebody is quad dominant and you're giving them quad dominant exercises, you're actually doing them a disservice. So giving them stuff that's going to work and that is simple enough for them to do outside of the clinic, that they're not going to either injure or re-injure themselves, that's going to be huge, because now they have a way of doing it without you. And again, a lot of this has to not only do with how you're treating them, but how they're treating themselves.